Clearly, this is the first news conference that I've called since I've been mayor. And I can't think of an issue that's more important to call a news conference about than what's currently being discussed in the state of Maine in terms of 65,000 people potentially losing access to health insurance. And if in fact the governor's proposal goes forward, the emergency room, will become the health care for those people in the state of Maine. And it will have dire consequences not only in the city of Portland, but ripple effects throughout the state. Just in Portland alone, we will experience $2 million of loss of funds that will affect school health programs, prevention programs, programs for the homeless, and programs for working families.
Good morning. My name is Suzanne McCormick, and I have the honor of serving as president of the United Way of Greater Portland. And I'm here today on behalf of the United Way of Greater Portland to also share our concern about the magnitude of the cuts and, most importantly, the vulnerability of the people who will be most impacted by them. We know that the cuts are going to push more families into dire circumstances. Already, our homeless shelters in Portland, both at the city and at Preble Street, are overflowing. People are really just striving to meet their basic needs right now. And when we say basic needs, they're really basic needs. It's food, it's shelter, it's clothing, it's health care. They are basic needs, things we all deserve in our lives. And we know, as Mayor Brennan pointed out, that Greater Portland is not a community in and of itself. This is happening in communities across the state, and it's going to only happen more if the cuts go through. We are especially concerned about the cuts to eliminate health insurance for the 65,000 Mainers, or to eliminate in totality health insurance for 56,000 people. And we know that people without health insurance don't go without health needs. And as Eileen said, and as Mayor Brennan said, without health insurance, they're going to continue to have need, they're going to put off need, their needs are going to get worse, and when they ultimately have to seek care, that care is going to be sought here in the emergency room. And ultimately, it's going to cost more than it would have had they gotten care in a preventative nature with health insurance. We believe a better alternative to eliminating MaineCare eligibility for thousands of Maine people would be to focus on reducing costs for the highest volume, high-cost users. As Mayor Brennan pointed out, with better care for those high-cost users, about 55% of MaineCare costs come from 5% of its members. We can help them have better health outcomes and ultimately reduce costs. So much of this debate over the last couple of weeks has been about cost. It's been framed by cost. I want to urge us all not to lose sight of the fact that what we're really talking about is the health and well-being of people. People that we pass every day in the aisles of Hannaford, people who we sit next to at school assemblies, people who we're going to stand in line to vote with. They are people. We are making inhumane choices for humanity. People is what this is really about, and there are alternatives to balancing the budget that will not take such a great toll on people. Thank you.